Already dove in. Eloise, how are you today?
I'm good. Thank you so much for having me.
Absolutely. But for those of you listening at home, we connected over a couple weeks ago, 3 weeks ago now, at the SOCOM Care Coalition conference, and you're part of an amazing Sunstone Therapies. Did I say that right? Yeah.
Yes,
Thank
Sunstone.
you. And I think right now, like the hottest thing for treatment, and rightly so, is psychedelics. And I am a novice intellectual when it comes to my knowledge of psychedelics, but that's why you're here today, because not only are you passionate about it, you're working with a group of individuals that are also driven to not just be of service to everybody, but surprise, to veterans and military. And in today's world, we are so just bombarded with information, but we don't always get the right things. And I think just even talking within my peer group, a lot of guys have misconceptions of what's legal, what's available. So today, Eloise, you're here to help us with this. So please give us an introduction.
Yeah, well, thank you so much for having me. My name is Eloise. I am the communications coordinator at Sunstone Therapies. And Sunstone is a company that's really dedicated, as you said, to setting a high standard for the delivery of psychedelic-assisted therapy. We currently are running clinical trials with a number of different psychedelic compounds for different psychiatric indications and different mental health challenges. And as you said, this is something that I'm extremely passionate about. I feel very fortunate to be in this field at this time and with a company that is so mission aligned about making this treatment accessible to all who may benefit from it.
Yeah, and it's I think we're still a few years away, but let's start with how did this become a passion for you? Because this is like there's a lot of science, there's a lot of data, there's a lot of like so much schooling goes behind this. Not just a simple thing where you wake up like, well, I want to study psychedelics. Like you're committed to something for a long time.
Yes, I actually got started when I was introduced to the book How to Change Your Mind by Michael Pollan. And that was introduced to me in between my sophomore and junior year of college. And I attended Pomona College in Claremont, California. And at the time, I was already majoring in neuroscience. That had already was always a passion of mine and an interest. And I was always really concerned with, kind of this epidemic of
Mhm.
mental illness that we have in our country, but also the lack of adequate treatment and understanding in general about these different mental health challenges. And reading the book, it gives a wonderful, comprehensive kind of understanding of the history and the research and the neuroscience and state of psychedelic research. And so that really initiated kind of my own interest in research. And I had the great fortune of working actually as a research assistant for a summer at the Minneapolis VA doing,
Oh
I was
wow.
with Dr. Paulo Sharoma doing ketamine therapy for, and partnered with prolonged exposure therapy with veterans. And that really just again seeing
Yeah.
that work, kind of seeing that initial really interesting combination of psychedelic treatment and an established therapy model, and trying to use ketamine to help with the efficacy and kind of sustain, and it's in the program of prolonged exposure therapy. And after my work at the VA, I was in my senior year of college, and I wrote my thesis comparing the neuromechanism, delivery, and outcomes of psilocybin and ketamine for major
Mm.
depressive disorder. It really just started when I started researching this, the findings, these preliminary data that was coming out of these studies was so transformative. It was
Yeah.
incredible. It was rapid, it was sustained, and it was pretty unprecedented for treatment, options that we don't have currently for things like PTSD or treatment resistant depression. So I kind of knew that I was really interested in mental health care, and this was the field that was the future.
Yeah, it's remarkable how much change you can see in a veteran after they've either participated in ketamine, psilocybin, or DMT. It's remarkable. I mean, We talked briefly about how we both felt about DSM-5 and modern psychiatric treatments. It's a, hey, let's get you a dose. I mean, VA, like it or love it, they made a deal with the devil. They partnered up with big pharma, and now every veteran, just like me, you get your giant brown box or bag every time you go for your prescriptions, and it's ridiculous because it's not issued to you with a check in with a doctor and you talk about what your symptoms. No, you get prescribed Prozac, you're on that forever. Nobody's telling you like, hey, these things, like for example, I never knew Prozac stayed in your body for a really, really, really long time. That's scary to me. I had to find that on my own. And there's nobody that's willing to talk about like the long-term effects. Whereas we're learning now through these trials, through what you guys are doing at Sunstone Therapies, is that there's great avenues of healing in these modalities. And it's not like you have to continue taking them over and over and over again, which is, hey, exactly what I'm looking for. Something that I don't have to like completely take for the rest of my life, that it's going to be with me. And then I have to question like, okay, is it's going to harm me down the road? And there's so many of us, and civilians and veterans alike, are wondering, what is the long-term effect of taking these pharmaceutical drugs versus psychedelics world? And when we talk about psychedelics, we have to pause and we have to like really line out like the key players, like the big key players. What are the ones that are getting the most attention and have the most testing and show the most positive results?
Yeah. To one of your points about kind of a misconception about psychedelics as just another pharmaceutical treatment, which I'll go into later, but I do think it's really important to acknowledge that this isn't intended to be a daily dose or something that you're taking continuously. This is a really transformative treatment that is difficult and it takes a lot of work. But the findings that we're seeing from 1 to 3 dosings is really amazing. And that has long-term results from just 1 or on the higher end, 3 dosings. In terms of the key players, we are seeing that I'm sure most of your listeners have heard about MDMA. That is kind of the top dog at the time and kind of the key buzzword. And MDMA right now is up for a rescheduling. So it has a new drug application with the FDA that is set to be kind of announced in August 11th. And it's specifically for PTSD. And so what that means, that has the highest level of kind of clinical trial data. It has phase 3 data. So phase 1 and phase 2 are smaller sample size clinical trials that are focused on safety and efficacy. And then phase 3 are larger trials, so you have more participants, and you're trying to confirm kind of that safety and efficacy. So 2 phase 3 trials involving MDMA-assisted therapy for PTSD are kind of being presented as evidence that it should be scheduled. Currently, it is a Schedule 1, as most psychedelics are. And this happened in 1970 with the Controlled Substance Act. And Schedule 1 compounds are classified by having high potential for abuse and no known medical use as well. And so this data is really trying to present, hey, there is medical use with these compounds, and we should reschedule them so that they're easier, there can be more research done, as well as easier to access. With that, we're seeing 2 other compounds that have received FDA breakthrough designation, and that's psilocybin for major depressive disorder, as well as LSD for generalized anxiety. So those are other compounds that are undergoing and involved in clinical trials. There are a lot of other psychedelics that are still being investigated. Ibogaine is an extremely potent psychedelic that is commonly being used in kind of retreat settings, as well as ayahuasca. DMT is an extremely potent psychedelic as well that is kind of in early stages research for treatment-resistant depression. So this is really like novel research, right? We have a lot to learn still, but we're seeing pretty incredible results from this data, including not only efficacy but safety as well, and really kind of sustained results.
Yeah. And I want to pause and highlight MDMA because we've known there's been studies that shown, I mean, they were using it for couples that were dealing with lots of complications. It's been studied and people have been trying and championing this for such a long time. But because it was banned, we've had this constant like back push and backpedaling from government officials and established, I'm not going to say who, FDAs and all sorts of different organizations. They just don't want to see it be brought to the market. Um, what exactly happening at the neurochemical level? What is MDA doing for us? It's allowing for individuals that are dealing with PTSD to sort of, within the several, just a handful of treatments, be able to overcome that. I mean, uh, I've seen in my own lived experience, EMDR, CBT, lots of great things that you have to be like on it. You have to be willing to dive into that. But it seems like MDMA is not having the individual divulge the situation and verbally talk through it, but it's helping them process it at a chemical and neurological level. What's going on?
Yeah, MDMA is really interesting. It's categorized as an empathogen, so it's not a classical psychedelic because it interacts not only with serotonin receptors but also dopamine and oxytocin, and it really is characterized with strong feelings of empathy and connection.
Yeah.
We see increases in social engagement, in openness, in empathy, really critical kind of emotions that can help when dealing or processing trauma. And interacts with brain regions involved in memory reconsolidation and fear extinction processes. So we're seeing like distinct neurological pathways involved in PTSD that are targeted with MDMA. And this allows
Yeah.
for new insights and expanded perspectives and empathy towards oneself in particular during these experiences. And I think it's critical that it can kind of create this distance or respect to address trauma that doesn't feel as overwhelming. And you have kind of this different perspective when addressing it. A critical component that I want to emphasize is that we say MDMA and it's with assist therapy. And so people
Bingo.
that are going
Yes.
through these clinical trials are involved in a lot of therapy, and that happens prior. You have preparation sessions with a therapist, and that's to establish expectations. I think kind of one of the things that's happening within the field is, a saturation of hype around these
Yeah.
medicines, and so really adjusting for expectations about what this process is going to be like, setting intentions for the journey itself,
Mm,
as well as creating a therapeutic bond and relationship as you're going to be trusting this person with a really vulnerable experience. And so a therapist is also there for the dosing. And so that's when we're actually seeing an administration of the medicine. And when we're seeing kind of a lot of and no two experiences are like, but for many people there's a surfacing of trauma and there is a kind of confronting acknowledgement of an experience. And so having trained therapists that are trauma informed to handle those situations in the dosing is really important. But then the work really happens in the integration. So a lot of insights can come during the experience, but then it follows where it's um, grappling with the insights and then figuring out how to integrate those into your daily life for really meaning and benefit.
I'm so glad you said that because there's a misconception within the veteran community that this trauma that I'm holding on to, if I can just wait a little longer, wait and put off having to be vulnerable, I'm going to go into these, go to these venture off into the woods. I'm going to do all this assisted therapy and then I don't have to talk about it. And the reality is, no, when you sit down and do a treatment, you have to have somebody that's there with you to guide you through it and be able to put a little bit of context and help you deal with what you're still holding on to. It's not a magic wand like anything
No.
else. There has to be a proper procedure that's followed, and it's scary because we're seeing a lot of especially with ketamine. We're seeing a lot of ketamine clinics, and there's
Mhm.
even at home. There's all these advertisements on social media where, hey, get your ketamine delivered to you, and it's like,
Yeah,
what
mailed
the
right to your door.
fuck? Yeah, and I'm like, hello, that's a very dangerous thing. Hey, ketamine's been abused, MDMA's been abused,
Mhm.
been utilized recreationally.
Mhm.
These are powerful medicines that if you take them and you don't have somebody there with you to guide you along the way, you're not gonna
Mhm.
have a great time. Or
Our
you might not be able to actually get to the point where you resolve your issue, and then you're constantly chasing this, and then
mhm.
you're not getting anywhere.
Our
Um,
CEO always says if it all it took was taking MDMA, anyone who's been to a rave wouldn't have trauma. That is just not that's not the case, that's not what we're seeing, and there's really these key components too of set and setting is talked about a lot within the
yeah,
psychedelic field of therapy is your set is the kind of mental setting that you're bringing in,
mhm,
and that is why prep is so important too, and discussing your intentions and making sure that you're supported and in the right space to be engaging with these, as well as the setting in which you take them, like you're saying, going out into the woods by yourself. um it might work for some people, but for others, you need to be within a safe environment with a
yeah.
trusted support. And then to get the most benefit from it, working through what comes up in integration sessions after.
Yeah, it's 100%. It's scary to think that we live in a world where we still have access to these things, and people just think that they can jump into it and just try anything and everything. So, one of the questions I do have is, when we look at psychedelics, how do we know which option is best for us? A
Mm,
lot of us are dealing with dual diagnosis. A lot of us are dealing with alcohol and drug addiction as well. So we see the success of these retreats where individuals that are dealing, and like, we have drug issues within every aspect of the veteran community, whether you're soft or regular active duty. We have people that are suffering, and I think it's important to know what's the best approach. Is it has it been broken down so that we know, like, hey, if somebody's dealing with just anxiety and some depression, this is best for them, and we'll do MDMA for PTSD. But what if somebody comes across the board and they're dealing with, do we have a clear avenue of approach for what modality is best for the patient?
It's a fabulous question, and honestly, the answer is at this point, not yet. I think with the process of clinical trials, we are seeing a kind of pairing of psychedelic
Yeah.
compound to indication. And that's not to say that a different psychedelic wouldn't be effective or wouldn't work,
Yeah.
but it's just the way that that research is working, and how approval will work as well. With that being said, I think that as we learn more about these compounds, it might become more of an individual basis of what a person
Yeah.
needs and less tied specifically to the indication. We
Mm.
have a trial, we just closed a trial actually that was, we participated with psilocybin for PTSD. And so really trying a new or a different psychedelic
Hmm.
compound for PTSD. They're kind of in their lanes right now, but I think you bring up a really good point of as we're ending. And there's also kind of going to your point. A lot of people are like, how are these working for all these different things, right? We have trials
Yeah.
for we have trials for depression, anxiety, OCD, eating disorders, and it's across. We're seeing so many different um, kind of mental illnesses that are
Yeah.
being investigated for psychedelic compounds. How is that possible? And I think it really speaks to maybe our lack of understanding for the biological basis of these kind of illnesses that we categorize
Yeah.
as segmented or different, when it perhaps is more of a spectrum, and we see comorbidities in a lot of participants. It's rare that you would only have one diagnosis. It's more of
Yeah.
a primary diagnosis. So I think this is an evolving field, and we're understanding more and more about maybe what is best serves an individual. With that being said, I think there are more studies. It's really about, I would say it's less with the specific psychedelic. I think
Yeah.
that they're, researching studies that are open for indications, but it's not a one-to-one as
Yeah.
clearly as it may seem.
Yeah, maybe someday. 'Cause that's one thing that I've seen a lot of people ask and figure out, like, how do I know which one to go for? Like, if I volunteer for a study, it's pretty much you go there and be able to identify everything. You're meeting with individuals that are well informed, they understand, and they're willing to put you in the best state and setting, the best place with the best tools to try to combat these issues that we're all dealing with. And I think that's, hey, and this is what we got, and that's great. Maybe down the
Yeah.
road, be able to identify exactly what specific psychedelic. But at this point, facilities such as Sunstone Therapies, they have the research professionals, they have the individuals that are informed that can make it completely clear, like, hey, this is a great place to start, um,
Mhm.
which is phenomenal because there's so many of us that don't know what to look at, and it's best to be able to walk in and go somewhere and be able to say, "Hey, look, this is what I'm dealing with. What do you recommend?"
Mhm. And I
I
think
want to ask you about
understanding
some.
that
Oh, go ahead.
I was just gonna say that, each psychedelic is different too, and so there's
Yeah,
different lengths of acting too, and it's different in potency. So, for example, we see LSD on the longer end of 8 to 12 hours, whereas MDMA usually is between 4 to 6. Whereas DMT is an extremely potent psychedelic, but lasts between
yeah,
30 to 40 minutes. So they're really different too in that sense, and if you know kind of going in,
yeah,
what but it's not, it's at this point, you can't select. You can't be like, "Oh, I want,
yeah,
MDMA or I want psilocybin." Unfortunately, we are bound
yeah,
to the clinical trials and their protocols.
yeah. And that's great because individuals like myself that are just able to study, that don't have the institutional knowledge, I can be excited about psilocybin all day, but if I'm a participant in a research study and it's recommended that I do, substance A, like that's what I'm going to go with because, it takes, I don't have the time to get the neuroscience degree and be able to say, no, I am going to challenge this. But I do want to ask you about my favorite one, psilocybin. As I've, in my little detective work and reaching out and talking to individuals that have sort of been taking the entrepreneurial approach to these substances, understanding and doing research and understanding that there is, you know, substantial research showing that it does help individuals such as myself that are dealing with not just with diagnosis of PTSD, anxiety, and depression, but also with TBI. It's showing
Mm,
great efficacy in helping individuals get back their ability to have conversations like this, the ability to be more approachable. What are some of the things that you guys have seen with psilocybin?
yeah, psilocybin is really, an interesting compound. We, were found by oncologists, so we actually have quite a few studies that focus the kind of emotional side of cancer, and so we, studies with cancer patients with major depression, and that was actually our inaugural study was a, psilocybin, a single dose with cancer patients with major depressive disorder,
Mhm.
and it was a group therapy model as well, which is a pretty innovative model to psychedelic therapy. And so individuals received a dose in a separate room, in an individual room, but on the same day at the same time, and then came back the
Mm.
next day for group therapy. Um, and really incredible kind of takeaways from this, and especially within thinking about a group model and kind of
Yeah.
as I mentioned, kind of the empathy and connection with MDMA, you also see deep connection and kind of senses of unity with other psychedelics, including psilocybin. Um, that study, we had an 18-month follow up. And at that point, we were seeing still very high levels of not only response rates for their depression severity, but also we had over 50% that were in complete remissions, no longer qualified
Oh,
for
wow.
having major depressive disorder at the 18-month mark. And this was not just terminally ill, although there is research specifically with end of life and palliative care with psychedelics. But there's also an acknowledgement of the anxiety that happens, and kind of lingers over someone, even someone in remission. Um, With that being said, we also have a study right now with MDMA, but going back to your comment about couples therapy. And so this is
Yeah.
a dyad study that has a cancer patient and a concerned significant other. It has often been a spouse, and they both have an MDMA session, separate rooms with individual therapists. And then they come back and have a dosing session together in the same room with both their therapists present. And that is for addressing adjustment disorder and really acknowledging
Mm,
that mental illness does not affect an individual. It affects
yep.
communities, it affects family units. And you know this better than anyone that in order to
Yeah.
kind of address we need to include communities and families in this treatment as well. And so that has been a really interesting study, kind of addressing the role that the
Yeah.
caregiver plays, the role that a
Oh my
spouse
God.
plays,
Yeah.
and how that affects a relationship and how we can include them and in this treatment.
That is so amazing. And it's something that I talk about all the time. Um, when we address just a service member, just a veteran, we have great success if they're able to go on outpatient treatment, if they're able to get into EMDR, CBT, DBT, mindfulness, and they get 3 months to really work on themselves. And they go home and maybe they got access to stellate ganglion block and they're truly downregulated. They go home to their wives and their wives are burnt up. Their wives have just been keeping everybody alive in the home. They've been taking care of the kids
Mhm.
and they've been dealing with the same depression, the same anxiety, because everything that you're dealing with, you bring it home to the family. And then
Mhm.
you walk in the door, you're this happy, well adjusted, you have this new lease on life, and there's your wife, frazzled, just done. She's like, yeah, I'm glad you're meditating, asshole. Yeah, I'm glad you're looking good. But it's something like this where you can take the wife and the husband. I mean, these are marriages that have been, you know, they've been through the ringer. They've been through combat. They got 10, 15 years together with little ones. And it's sad to say that when that person comes back and they're healed and they're great, there's a lot of pent up anger. And
Mhm.
if you could take both of them and treat them and then give them the tools at the same time, holy
Mhm.
cow, preservation of force, family stays together, the individual doesn't get out of the military. We could just friggin' really, like, we could address retention with just dealing
Mhm.
with the issues as a family unit. That is mean. Like that
Yeah.
is. Have you guys been able to start doing those tests with military couples at all? Is that something that maybe you could see in the future?
Hope to see in the future. I think currently that trial is cancer specific, which doesn't mean it doesn't
Hmm.
cross over as well into the military community, but that is
Yeah,
kind of the primary lane for that. But I think exactly what you're saying. This is really trying to kind of set a precedent too for how we think about the model of delivery and who needs to be included, and as well as the integration programs after. Like you're saying, someone comes home and they've changed in their thought patterns, they've
yeah,
changed in their perspective, but that doesn't change, all that has happened or, things that have happened in the
yeah,
past. And so acknowledging that this treatment is really the start to the healing journey, that this is not something that you leave and you're, nice bow on it and you magic, healed. It's really the start. It kind of it's to empower you to continue on, and I think gives you tools, gives you perspective to continue on in the healing journey. But no one can do it alone, and so
yeah,
bringing in communities and family members into this care is really important.
yeah. Absolutely, it's something that we have to always address, and I think we have a greater success too of individuals sticking to their treatment and sticking to their mental health journey when the entire family is involved. And it's one of those things that I understand intimately. You have to do the healing for yourself. You have to want to get better for yourself. But it also helps if your wife has the same tools and has the same resources. And when you're having a bad day, you look over and she's like, "Hey, why don't we go do yoga? Why don't you go
Mhm.
meditate?" And remember, we still have this trial that we're a part of, and we're fortunate we get to go do this together. So that's an
Yeah.
amazing thing that I hope to see when we look at And this is always the fun part, looking at the law state, or the state of laws, and the things that we're waiting to get approved. Currently, the military will not allow service members to just go out there and use these, be part of these studies. But for our veterans that are out, how do they get involved in these research studies?
Yes. So the easiest, I would say, is to go to clinicaltrials.gov, and that really is a kind of wealth of information about clinical trials that are currently going on. And you can filter by types of trials, you can filter by your location. So that can kind of give a wealth of information about what's near you and what might be available. I think also there are a number of academic institutions that are undergoing or conducting psychedelic research, and it's really a matter of kind of applying. Most of them are on an application base. And
Yeah.
with that being said, there are strict protocols and screening processes for these trials, but this is something that our government is really interested too in funding and making this available to veterans and to help in the funding these programs. And it's important to note as well that because they're clinical trials, they're at no cost to the participant. So
Okay.
travel is not always covered, or but participating is not at a cost. And so that's something that we love to kind of advertise, that this shouldn't, we want to make this and that's something that we're really passionate about too, as commercialization is potentially on the
Yeah.
horizon of, okay, how do we still make these treatments full and available to all who may benefit regardless of financial position.
Yeah. And I think that's an amazing thing, that we're only going to get better by promoting these trials, by promoting, like, I mean, just a few years ago, I had no idea about any of this stuff. I was just quietly suffering, going through my life, thinking that all these compounds were just dangerous drugs to stay away from. And now, after educating myself, after doing research, after meeting individuals such as yourself, and seeing like that the passion behind individuals are committed. I mean, you walk into a VA hospital, or not every VA hospital, but nobody's excited about new treatment modalities. Nobody's excited to like heal you or talk to you about new things that are going on. It's very much walk in, do your blood work, walk out, or set up an appointment for like 5 months down the road. But when you talk to anybody within this space of treatment and healing, everybody's engaged and they're bright eyed, and they want to talk about the latest studies. They want to talk about the new freaking endeavors that are being worked on every single day. Um,
Mhm.
what are some of the things that you guys are doing at Sunstone that really excite you and make you just be a proud member of that organization?
Yeah, I mean, there's so much, honestly. I feel really fortunate. I think that one of the things that stands out in the field in general is, this treatment doesn't work for everyone. Like that should be
Yeah.
stated. This is like all medicines, it doesn't work for everyone. But I think it really is such a hopeful treatment for so many people who have not had other options. And so to see
Yeah.
positive results coming out of severe PTSD trials and treatment resistant depression trials is really something that's incredible. I think Sunstone in particular is really pushing the bounds, like I mentioned with the dyad and with the group therapy. I think um I'm really excited about not getting comfortable in one model of delivery, but really kind trying to see and push the bounds of what actually is the best way to deliver this. How do
Yeah.
leaning on a group and having a community to integrate with, how does that help people? Um as well, I think I really strongly align that we believe in the therapy and we really value the therapeutic component of this treatment. That is, it is therapy assisted by psychedelics, that you need trained professionals to help people and guide people through these experiences to really have the highest efficacy. Um, this is really, I am fortunate enough to conduct some of our qualitative interviews with participants after they complete and can get some of their insight. And I think for a lot of people, it is just such a gift of perspective and living life. I do a lot of interviews with our cancer patients, and people comment that with a diagnosis such as cancer, they can stop living fully. They can, get into this stagnant state, and that this really can reinvigorate a joy of living. And it's hard to not get excited about something like that, and to really kind of see what this work is capable of. And it's an uphill battle. It's not going to be something that's easy or simple, or won't be without kind of adverse events in the future. This is not magic. It's not perfect, but when done with intentionality, when done in a professional setting with effort, it's I'm humbled by the results, and by the light that is given back to people.
That is awesome. I mean, if anybody's watched the Netflix documentary on how to change your mind, it sticks with you, specifically the segment on the cancer patients. Seeing the individuals and the way they talked about their journey, I mean, what can be more fearful and dreadful than a diagnosis that your journey on this plane is limited now? It's coming to an end, and for the family members as well. But being able to give somebody the peace of mind of, hey, this is a journey, and while it might come to an end now physically for me, there is something on the other side, and I don't have to fear this anymore. And it's easy to say it, it's easy to talk about it and engage with it, but to be dealing with it, to actually be living in that diagnosis, like, you have to understand that there is so much pain, so much fear and regret. And to be able to give somebody that peace of mind and that ease for the last few days or months, that's beautiful. Now, just imagine what it can do for us that are dealing with all sorts of different diagnoses that we don't want to continue taking pills for, or maybe we still have a difficulty even talking about it. That is a beautiful thing, and I cannot wait to see where it's going. Before I leave you off the hook, I do want to move towards ketamine, because I feel this is the one that a lot of individuals are being sold this idea that I can just take it at home with Hone's ketamine clinic kit at home. And there's a lot of ketamine storefronts, I'll call them, a lot of places where you can just get treatment. But there are two different types of treatment. You can use ketamine for pain, for chronic pain. You can use ketamine for dealing with PTSD. And a lot of individuals don't understand that you have to be guided still. You need somebody with you. There's a protocol to follow. What are your takes on ketamine and how rapidly it's being utilized outside of a proper setting?
Yeah, I think ketamine is a difficult one because of it was a Schedule 3, because it's commonly used as an anesthetic. And because it was at a lower scheduling, it was able to kind of move into this sphere without as much clinical research behind it. With that being said, I think really, reiterating what you're saying of this should be done in the proper setting. Ketamine can be extremely beneficial for people, and right now it's at a state where it's a lot more accessible to people as well. But it is really important to kind of understand, like you're saying, I think people go into it not really necessarily understanding what they're about to experience. And because there isn't the same process of prep and guidance and it can leave a lot just on the person to kind of enter into this state alone in maybe a sterile, office room or medical room. And so I think there is a lot of danger in delivery that isn't mindful or isn't guided with. So I think ketamine-assisted therapy is really critical, and I'm kind of understanding or having support after, if you're not able to go to a clinic that has therapy as a part of the process, making sure that you have a therapist lined up to then help with the integrativeness. I think is really critical. I think it's also important to understand that MDMA won't just become what ketamine is, right? We don't
Yeah.
expect to just see MDMA kind of delivery clinics popping up all over the place, and
Yeah.
we wouldn't want to. I think that it needs to be handled cautiously, and so we're expecting to see if it is approved that it will go through a slow kind of rollout phase with clinics who have possibly engaged in clinical trials and know or have experience with these molecules. And it's unknown exactly what the requirement for therapy will be, but we're almost positive that some aspect of assisted therapy or guidance will be required with this treatment. So I think you're exactly right. It needs to be done intentionally. And I also think that one thing that we kind of talk about or is kind of it's still novel in the preliminary preclinical research or research into kind of the neuromechanism, but one of the reasons why it's suspected psychedelics in general to work is this idea of neuroplasticity
Yes.
and the idea that your neurons can there's some preliminary data around actual dendritic growth or neuronal growth. You're actually kind of having new neurons, new connections form within your brain. But I always like to say that synaptic plasticity by itself is not inherently good, right? Having a malleable brain state or having new connections isn't inherently good. And that's why you need to have support. That's why you need to have guidance. You don't want to find yourself, falling back into old patterns and understanding kind of neurologically the state that you're putting your mind at when you engage with these compounds.
Yeah, that's actually a brilliant point that a lot of people aren't thinking of. You go through this and you've got this great feeling and you're not able to get guided through the next steps. You're gonna go right back to where you are, maybe regress in your therapy in what you were going through. And that's something that a lot of people don't. I mean, you're gonna walk out feeling high and great and wonderful, and it's just like this bright new world, but you still need backside support, like
Mhm.
anything else we've ever done in our careers in the military. Like after that initial success, you still need to come back and AAR it after actions review. Like, and that doesn't change for going through these new therapies. It's still the same thing. You go through something great. You go through something amazing that your mind probably can't comprehend. So why
Mhm.
would you go back home by yourself? You need to be able to do this with somebody that can help guide and it put some and help you with a frame of reference for what you're going
Mhm.
through. That's why I'm still a big advocate for making sure you're still plugged in to a conventional therapist, a counselor, a
Mhm.
peer support system, people that are informed. You can't do this alone.
Yeah, you really can't, and especially, these study protocols, they do end, and there is a time when you are no longer seeing your study therapist, so having ongoing support is also really critical. Like you're saying, these experiences aren't integrated overnight. They take time, they can take months or years to fully process. One other thing that I will say about ketamine is because it works through a different neurological mechanism. It involves NMDA or glutamate receptors. And
Okay.
because of that, typically you do not have to be off of antidepressants to go through ketamine therapy. So I think
Oh,
that's a really big thing to highlight is that part of participating in a clinical trial is that you have to wean off of medication. Part of that is for, not wanting it's a research study, so you don't want to have conflicting medication at the time. Um, Additionally, most common antidepressants are SSO SSRIs, and so they interact with serotonin. And since classical psychedelics such as psilocybin, LSD, MDMA isn't classical, but it does interact with serotonin as well, you do have to go off of those medications. Whereas ketamine, because it works through a different mechanism, people can still be on their antidepressants when they're going to ketamine clinics. So that does make it,
yeah.
more accessible as well because it is, not a easy process to wean off, and you do need physician kind of guidance for that process as well.
Yeah. And as a note to anybody out there in the audience listening, that doesn't mean to come off your medicines just because you're going to try a clinical trial right now.
No, no.
No.
Your
You
your
go,
physician will
you go
guide
through
you
the
through that.
process.
Please, yeah, please do not.
Exactly.
And don't do and
Don't
it
just,
you know, or if you're, planning to use recreationally, that is also not to say to stop taking your antidepressants. It's really that is not the advice at all. That is more of a,
yeah.
process and safety measure for the trials.
Absolutely. Everything that you do, regardless of who your primary care provider, and I get it, the VA is not always the best depending on where you're at. There are good clinics, there are bad clinics, or good providers, or bad providers. Regardless, stay on your medication, develop a plan of action to downstep because you never know. I've witnessed it. I've seen friends go through it. They say, I'm tired of this stuff. They've been taking the medication for 4 or 5 years. So what does that tell you? Your body's going to now go through this entire system of like, what the fuck's going on? No, you downstep with guidance from your provider, and you do it when you need to. If you're going to participate in a clinical trial, they will let you know when to do that. Eloise, thank you so much for being here today. The last thing before I let you go, I know
Yeah.
you're a busy professional, but in your own personal lived experience, what are some things you're excited about in the future with these medicines?
Hmm. I think I got into this work for honestly personal reasons as well, with seeing the effects of mental illness and struggling with mental challenges. So I think that personally, I'm really excited to see the development of this field and to see this work become more accessible, to see more people being able to get involved in this therapy. I think that we've scratched the surface on what they're capable of, and I think as a neuroscience student, I'm really excited to better understand what's going on in our brain, as well as a deeper understanding of consciousness. I think is something that
Yes.
has always interested me, and I think these compounds really they're fascinating in our understanding of altered states of consciousness and what that means for a kind of baseline state of consciousness. So I think I'm really excited for these to develop and become more available, as well as kind of from a research standpoint, better understand our brains and better understand why we think the way we think and why we are the way we are.
Awesome. That was perfectly said. I don't have another follow-up question. That's beautiful. You can change our minds and we can ultimately change the world. I do believe that there's something to these compounds. Every close friend that I've had that, and psilocybin, like I said, psilocybin is something that I've seen the changes. I've seen the positive change in somebody that was just completely a shell of their former selves. And with just a few, was back to being a flourishing, vivid, fully alive person. That's change that's remarkable. That sticks with you, especially when it's somebody that you love and care about. So if you're out there and you're still on the fence and you're still like me at the, few years back where you think these compounds their drugs are evil. They're not drugs, they're medicine. And fun fact, they're a hell of a lot better for us than 90% of the shit that you get from the VA. So please, if you're willing to write and advocate on behalf of these treatments, do it. Talk and engage. Be open to having this discourse with your friends, your immediate circle. And if they are interested in going to Sunstone Therapies, how could they get
Yes.
involved in one of these clinical trials?
Yes, so I would say check out our website, sunstone-therapies.com. We're located in Rockville, Maryland, but we do have patients from all over the world, actually. And on there, there's ample resources, more information about what clinical trials are, what psychedelic therapy is, as well as if you click Start My Healing Journey, you can actually register your interest. There's our clinical trials page. You can see we have 5 open clinical trials right now, multiple that are recruiting patients. So you can explore those. You can look at past trials as well, and register your interest, and that will start the eligibility evaluation process.
Awesome. And if you're listening to this right now, pause and go to the episode description, and that link will be right there. Eloise, thank you so much for being here today. Thank you for being a passionate advocate and a brilliant mind at champion this medicine for all of us. This is what we all need are people that are passionately engaged in their endeavors. So if you're listening out there and you're just half-assing your life and your profession, leave, run away from it. Find something where you're just as passionate as Eloise is and studying these awesome compounds and live a life. To all you out there, thank you so much for tuning in. Eloise, we'll see you next time. Take care.
Thank you so much for having me.
Always.